reviewing the existing tools that you have in Surgimate. We'll be looking at 5 main features, and then within your teams, you will need to decide, you know, on your particular flow to manage your practice's needs, request any changes required from customer success. You'll develop some documentation to support that new workflow, and then you'll want to distribute that to your team and train staff for those who might need new training or retraining or new employees around these changes. And, you know, if you have trouble with that amount of training, you can always reach out to customer success to help you with the session. So just before we get going, we'll do a little bit of polling just so I can know how to direct this, this session. I know there are a number of you from the same practice. That's fine. You can all answer on your own. So I'll hand it over to Sari.
Okay, great. So I'm going to launch the polling where you'll see a number of questions pop up on your screen. You should be able to see it now. And there are 5 questions. So if you could just select the answers and scroll down as you go, and then when you're done, hit submit. And can everyone see the poll on their screen? I guess you're all on mute, so you can't tell me. But I'm going to unmute it for now in case you have some questions.
I mean, Judy, would you say like over 80%?
Yeah, yeah.
You're able to see it?
Yes, we see it.
Is this a Zoom feature, this poll?
It is, yes. Hi, Jeff. Welcome.
Sorry, where it means multiple choice, it means you can choose more than one answer.
That's correct. Number 2, you can select more than one because we figured you might be doing both weekends.
Because we don't know for sure, right?
But if it doesn't say multiple choice, it's just one answer. So, but that's clear. All right, with this number of answers coming through, keep them coming. We'll give you a little bit more time.
Cancel patients is probably all I've done. There's a lot of things you can do. Yeah. So these are all people I've seen. Jude.
Abby, I'm glad you figured out how to get in with your camera. It's good to see you. It's great. All right, I still see answers coming through, so we'll just give it about another 30 seconds. Unless anyone's got some questions, I'm going to put everyone back on mute for now.
I do have one question.
Sure.
We have a quota system in Oregon now. We can only see for elective non-urgent cases 50% of our volume, and we have to prioritize them. So we're looking for a way to track the prioritization. I'm hoping that we can do that in Surgimate.
Yeah, that's great that you brought that up, Jeff. There are a number of different ways we can do that. I'm going to go through these 5 best practices, and you know, 3 of them are kind of applicable, and you'll just decide on which workflow will work best for you. It could be a combination, or it could be all of them, just depending. So I'll have that in mind when I present.
Great. So I've ended the polling and now I've shared the results. Just confirm that you can see those on your screen. Yeah. So I'll just briefly go through each question just so we all get an idea of where we're at. As far as how much your surgical volume has been reduced, the majority of you said over 80%, which is what we've seen across most of the sessions that we've run over the last couple of weeks. How is your practice planning to manage the surgical backlog after the pandemic eases? So I'm just going to put everyone on mute again. A number of you have said that you haven't reached a plan as of yet, but also looking to extend OR time for some of you on weekdays and on the weekends. As far as having a list of patients who are waiting for surgery, most of you said yes, so that's a good sign. And in the next one, what tool are you using to manage this wait list? We have a combination here. So a lot of you are on Surgimate ESRM, which is great. That's what we want to hear. A spreadsheet or a combination of the above. So a lot of the things that Rebecca's going to show you today are in fact how to manage that sort of a list in Surgimate. And here the final question we asked, if you're using Surgimate, how have you actually managed that in Surgimate? And most of you have said that you've tagged the cancellation reason as COVID or cancel the patient. So that's great. Thank you for sharing this with us. And we're going to incorporate that, and I'm going to hand it back over to Rebecca, who I'm going to unmute.
Thanks, Harry. So the main takeaways is that not everyone's finding a way to do it through Surgimate and is using a spreadsheet sometimes on its own or sometimes together with Surgimate. And it seems like the cancellations are being added a lot, but the follow-ups aren't. So I think that's what we'll focus on. So just to get going, the first thing that's always going to be super important when you have this kind of backlog, which of course has never been experienced before by any of you, is a way to manage the data. And we're going to do that by taking a deeper dive into the surgery search and reporting functions of the system. And then, you know, either through or a combination of, which I said to Jeff now, surgery status workflow. You all have the statuses, you have different statuses, maybe adding one or two for this process, or at least using what you currently have properly. Number three, the cancellation workflow, making sure that you have a proper informed workflow there to manage the cancellations, although I know the cancellations are occurring less now, obviously. Most of you have not much of a surgical schedule going forward. It still might be opportune to go back, and if they haven't been marked properly, mark them properly. And then the follow-up workflow we're going to review as well, with how to prioritise patients, assign them dates, urgency levels possibly, and you know, other reasons that you might, other notes that you might want to put in there and how to use that. And then finally is the checklist usage, which I think is the most basic. So to get going, and the first again is the data. So first we'll take a look at the reports, the calendar, and the overview. I'm just jumping over to ESRM, a system that you all know and love. Please let me know if you don't see the system. I think you do now. 1, 2, 3. There we go. So here, I'm on the calendar right now, and I'm going to jump over to the report. Some of you may not be aware that up here on the top left corner of reports, we have many, many reports, about 25, all which can show us surgeon volume, surgeon performance. We can look at tables of how many surgeries we've had. So if I want to have a look at my annual surgeries per surgeon in a quarterly fashion, I'm able to do that. I can bring up some of the doctors, all of the doctors. I'm not going to have much here because this is a demo database, but here we go. And then I come over here and I press preview. I can see the trends of what's happening. So I can see Q1 was slow, Q2 was faster, Q3 has, and Q4 have nothing booked so far. But I could, if I want, just have a look at my surgeries that are billing done status, right? And then I can see the numbers are very different. I could also look at billing done, surgery done, and authorized, for example. Or I could also just use cancellations on its own or follow-up on its own. But I'm not going to review all these reports because they're very self-explanatory. The main element there is to pick the set of surgeons, pick the statuses, and the time period. You can, of course, export this data to Excel if you want to, or into PDF format. Very helpful. I can also switch them, you know, I can change the format And the tables are super excellent in terms of comparing things annually by quarter. So I can look at Q1 of 20.
We've just got a question. Sorry to disturb, but we've just got a question on the floor, and whether the time period can be shown as weekly on these reports.
No, these are more aggregate reports that give you the big picture. And then once you leave these reports, you would, when you find the nugget of data that you want to see, that's when you go to the surgery search, which is what you're working with all the time, and you can glean specific data about patients over there. So I'm going to jump over there. So here I've got my surgery search. I'm right now on the pre-surgery checklist. The very most important thing for you to know about the surgery searches, and for those of you that are experts, I apologise, but I'm reviewing again. And I know most of the people on this call know this system a lot better than I do, so I do this with humility. You know, you're able to save different layouts, and it's really important to have them set up. So if I just want to look at my pre-surgery checklist, this might be a really good way for me to set it up. But, you know, if I want to add in, for whatever reason, my CPT codes or my procedure codes, so I come over here, I go to choose columns, I have about another 60 fields on the right side that are available. And I can move it over. I can also switch the placement, so I can decide I want it, you know, after the last name or whatever. And I'll hit OK. And now here my CPT code is. If I want to always see my pre-surgery checklist like that, I should save it. If I want to have it pre-surgery checklist plus CPT codes, I should rename it. So I'm going to use this as my default. For those of you that don't see these little features, they're slightly different. They're in a newer release. We'll be able to arrange an upgrade if you have the compliant hardware. And layout with this name exists. Do you want to override? Yes. So now my pre-surgery checklist has the CPT codes. Layouts are super important. Up here I have 5 or 6. If you're managing a team and you want to have a look, you know, what's happening with cancellations and follow-ups, it's a completely different layout. Again, if you want to look at, you know, Surgimate notes, that would, it's different again. So you always want to have the right layouts. They really save you time. Something else that is really important to note is over here, I can filter the data. So right now, I'm only looking surgeries from the 1st till the 30th of April that have the status of cancelled. Okay, and I have, you can see, you know, a whole lot of surgeries. I could filter it more by only selecting Dr. Diaz and Dr. Green, and it's going to limit my selection even more. Not everybody, no, I'm going to remove that now, and I'm going to see everyone again. I can do that on anything. I can do it on the surgeon, on the hospital, whatever it is that I want to see. I'm also able to group by. So if I want to view it by hospital, I drag it up, and then I look at ASC has 5 records, Howard Hospital has 1, Memorial has 1, Sinai has 1. So I can group it again. I can group it by hospital and then by surgeon. So I see ASC and then I see it broken down by surgeon. Now, I know this is repetitive, but I'm getting to what I want to talk about in terms of the flow and managing this cancellation. I'm also, of course, able to sort data. So if I just want to look at it, I just click on the top and it's going to sort it in that way. If I want to have a look at all my medical clearances that are done, I'll click on it there and I see all the undone ones down below. So let me just move over here. Sorry. Of course, I'm sure most of you are also aware, if I want to work a lot on one different set of data, I select up here and then I hit this export button in the middle and click it. We'll push out all the data and then I'll be able to look at it and run all kinds of reports and graphs. That will give me the weekly, if I run them weekly and save them, I'll be able to see the gaps in the data and how things change over time. And finally, I'm just going to jump over a little to the calendar. There's a lot of data in the calendar. And when you're looking for a quick visual, this is a great place to come. Of course, right now I'm looking at all my surgeries, my blocks and my vacations, but I could just look at my cancellations if I wanted to, okay? I'm looking at all statuses. Now I only want to see my cancellations. I can see them here, they're all in red. I can jump over to May and I can see them there. I can go into a weekly view for you. Those of you who don't use the calendar, this is really helpful visual. I can also, you know, turn off my blocks and my vacation. And in terms of getting your schedule up and running, sometimes you might only want to look at your surgeries and your blocks. And if you do take the time to fill in your blocks, I will tell you that it kind of makes it a lot easier to see what you actually have open, especially when I show them as real events. So I can see here that, you know, on April, well, today's the 30th, I have a full day open, right? It's all, I've only got that one cancellation that didn't happen. Of course, that's what's happening now. But as you start filling out the days, that will give you a very good visual, especially if you put the case length in correctly. Okay, going back to my slide. If anyone has any questions while I jump over, feel free to voice now if you'd like to.
Yeah, I've just unmuted everybody, so feel free to ask any questions.
Or maybe you can raise your hand. There's a little reaction there if you want to ask anything. That will be helpful. So the next thing to talk about is the status workflow. Okay. Obviously, you have to have an agreed workflow. All of you have different setups in your organisation. Many of you might have statuses like schedule, pre-cert complete, surgery complete, reschedule, follow-up. What you must have at the moment is cancellations, okay? So it's unlikely, but it is possible that some of you don't have cancellations. For example, I'm here now, I'm looking at all my surgeries from 4/1 till 4/30 again. Okay, so here they all are. Now, when I run on a cancellation, on the status here of cancellation, it's greatly going to reduce the number of surgeries that I have. Okay, if I had all my statuses open and I run it again, I can, of course, pick from over here, going back to setting up your layouts really well, push over my status, hit OK, and if I like, I can group by status. So I can see what's happening in each group and handle them individually, go through them. For those of you that are using spreadsheets, think about the fact that you're putting stuff in Surgimate and you're entering data in Excel. You have to think about what those extra fields that you're putting in your Excel spreadsheet are and make sure that we can handle them here for you so that you don't have to maintain two systems. And of course, you're getting all the data from your practice management or EHR that doesn't go to your Excel spreadsheet. So it's in your best interest to let us know where the data gap is so that we can help you. So of course, if I have my cancellations, I can have my numbers, I can increase my date ranges. And again, I could have seen that on the reports that we were looking at. So best practice, assign your cancellations. If you didn't, I would really, really recommend that if you have the time to go back and mark them, you know, mark the status. I know some groups are better than others about managing the statuses, but it is super important, okay? So the next thing that we're going to jump to over here is cancellation workflow. So what you're able to do in Surgimate is punch in when the cancellation happened, the reason that the cancellation happened, and any notes. Now, if we did send out emails and communications encouraging our clients to add one for COVID-19. If that's still the case, please submit a support request. We'll take care of it for sure within 24 hours. Because it's really obviously very, very important. And then any notes. In the notes will help you understand the micro issue for the patient and will really help you get off spreadsheets and paper notes. So I'm going to go back to Surgimate here. So just so we're all on the same page, I am looking at, I don't even need to put on my cancellations because let's say we forgot to use the status correctly. This button here, cancellation, lets me pick the cancellation reason. So all is not lost. If you haven't made the status of cancellation, but you put in the cancellation date, it will work. So that's what I'm doing right now. I'm not running a filter on the date. And just so we're clear, I'm going to go into a record so you can see where I'm talking about. So on the scheduling tab over here, you have a cancellation. Here you put the date that you did the cancellation, the reason for the cancellation, and the notes. Okay? So I would put whatever it was. So when I go back to my surgery search, I'll run it again, and I'm going to bring up the appropriate layout, which is cancellations and follow-up. And here I can see, here are my reasons. These are all my COVID reasons. I might also want to add personal reasons, and now I have 2 sets of reasons, right? You might have patients that you didn't cancel because of COVID necessarily, but they got pushed back because of COVID, because you're obviously not allowed to do surgery for some period of time. And I'm able to see here when the cancellation happened, what the notes are. And again, I can filter, I can sort them, I can group them if I want to, so I can see the trends that are occurring. You know, how there were more cancellations and they're kind of thinning out now, however it is that you want to display the data. And the notes, that's your Excel spreadsheet where you're putting those little tidbits of information. Those fields where the notes are contain a lot of information, I think about 250 characters, and you can always add another communication down here once that fills up. Some clients have created their own kind of way of options for notes so that they can group things more easily, and I'm going to go back to that in a minute. Any questions before I move on to follow-ups? I hope I'm not putting you all to sleep. I know that it's possible.
So you'll let us know how we can put that COVID-19 in as a cancellation status?
Yes, absolutely. All you should do is kind of ask the practice manager or whoever's in charge of contacting Surgimate, the customers, you know, the kind of the account manager on the practice end, and they'll submit a ticket and we'll do that overnight, or you can reach out to your account manager to handle that. It's no problem. So the next is follow-up workflow. So this is your book of business. This is your list of all the patients who have indicated that they want to have surgery. You know, this is basically what your surgeons are waiting to do whenever it is that they come back up. And I know that you're all in very different situations coming from different parts of the country, so we can't really speak to that right now, but either way, whenever it happens, you know, this is the state of affairs. You want to set a reason. Maybe you can add a priority level if you like. I would review them as a group, and you can possibly add a note and develop your own priority list through the notes so that you can sort further. So what I would say here about the follow-up is some groups have a habit of only putting the surgery in Surgimate once the the patient has said they definitely want to have surgery. And what I would say always is that a case should be entered into Surgimate once the surgeon has ordered surgery, even if it goes nowhere and stays in follow-up status. That way you always have a book of business of how many surgeries are open, and when the surgeon taps you on the shoulder and says, you know, what's happening to my surgeries, why don't I have enough on the books, etc., etc., you'll have a full list and you'll have all the reasons why they haven't, why, you know, it's not happening. They're going on vacation, they're getting second opinion, they're not quite sure yet, they want to try pain injections, whatever it is. So let's go back to Surgimate and review that. Oh, I'm just keeping an eye on the time. Sorry, I've gone a little over time. So if I want to have a look over here, for example, only at, you know, I could have a look at all my patients who are in follow-up status, or I could look at all my patients who cancelled for COVID, however it is that I want to look them up. And I see I have 14 cases here, okay? So here I have my follow-up dates. So again, I can sort them in order. I can group them. I can take care of them day by day. This one was assigned a date of the 1st of May going forward. And I can see, you know, what the reason is, etc. And I can see the notes. Now, just to go again into a record, here, the reason is patient requested follow-up. Some clients have requested, again, that we put in COVID delay. And in the notes, some clients have developed their own little protocols to manage when to follow up with the patient. Or they've requested that we've actually put 3 or 4 levels in here so they know when. And they say COVID level 1, COVID level 2, COVID level 3, COVID level 4, like I have over here in the follow-up notes. So I can group those and I can see, you know, it doesn't matter about the date. What I really want to do is manage it by these levels of emergency first, which will have been determined by the physician. So you have a lot of different options in terms of how you want to do it. The data is quick and fast to put in, so the more data you put in, the faster you're going to be able to kind of, if you haven't decided yet, putting in the data as you're going is going to let you play with it and see how you want to make those rules and how you want to, you know, proceed forward as a group.
Could you go back over where that level 1, 2, 3, 4 is? I think you said it's in the follow-up notes.
Right. So good question. Thanks for pointing that out, Jeff. So you can either ask us to add a few reasons in follow-up reason, okay? Or you can develop your own structure and be particular about it. And if everyone does it the same way, at least for the beginning of the sentence, level 1, level 2, it will just be able to sort it that way in the surgery search, as you can see I've done here. It's just kind of really being disciplined and on the same page. Now, obviously, if you're scheduling for different physicians, you know, it would be permissible to have different ways of doing it. Obviously, if it's uniform throughout the group, it's the best. Any questions? Oh. Okay, last item is checklist usage. Some of you might have a checklist item called early or wait list, and you could, if you want to, during this period, use those, especially wait lists, so that you can just pull up a list. It's kind of less graded, it's Boolean, so it's green or red, yes or no, and you would decide which one means which. I like it less, but you know, if that's you know, a good, it's still a good tip, and it's a lot better than an Excel spreadsheet because this is a database. And if you need any help around that, you know, feel free to reach out to us. So again, these are the 5 best practices to optimize your coordination. I am, you know, I would say within your teams, you need to decide on your flow, request any changes from customer success, develop that documentation and train your staff to implement the changes. We're always here for you. That's really the reason for this call. There's a bit of learning, but obviously it's only half an hour. I'll be happy to share more insights at the end of the call if people have questions. And Sari just has one more question on the polling right now. This is kind of more for us to understand where our clients are at.
Okay, so here we go with the next round. We're just trying to get an understanding of how you plan to prioritize the cases for rescheduling. So if everyone can see that on their screen, I'd appreciate if you help us out with some answers. The first question here is multiple choice, so you can select multiple items if that's what your practice is planning to do, or if something we've missed, then please tell us, because we're trying to learn so we can help you. And the second question, we also realize obviously throughout the country, very different situations depending on the COVID status. So we're trying to manage that as well to see who's going to get up and running sooner. Okay, I've got a number of results coming so far. I'll give it another 10 seconds.
While you're doing that, Sari, I'll just give Surgimate a bit of a plug.
Sure.
And say that you know, Surgimate is a fantastic app that was released in 2015. Some of you use it every single day, some of you use it less. If you're not able to access your machine at the office because you're working from home, you know, please download Surgimate from the Apple or Android stores. It does have a limited data set, but it does have all the basic information about every single surgery and the schedule in an agenda list or a calendar list, and it enables surgeons to accept or reject charges, and surgeons, you know, can add more information. If you don't have an account, it's free of charge. Feel free to submit a ticket or reach out to your customer success manager so that you can have better access to your surgical schedule.
Great. I'm just going to briefly share the results just so we can see that the majority of you said that the urgency level of the surgery is the main reason for prioritization, but there are a number of different people who voted. I'm curious who wrote other, and they could just share. I'm going to unmute everybody, just what that reason is. If it was you who said other, I'd appreciate if you would just tell us what it is so we can learn. Or you can post it on the chat. If you don't want to reveal yourself, that's okay too. Just with the second question, it looks like some of you are going to get up and running soon, or at least to start rescheduling. So that's great news, but a lot of you also don't know yet. So good insights. Thank you for sharing, everybody.
So we're starting the prioritization now, and we're looking for a place to put it. And so the follow-up note seems a little bit backwards to that. Is that the best place to put that level prioritization so that we can then decide, okay, the higher the level, that patient's going to get surgery or scheduled prior to everybody else?
Share with me why you think it's backward. I'm just trying to get into your head.
Follow-up sounds like it's somebody that's sitting out there waiting to get scheduled. Maybe I'm thinking of it backwards.
Oh, okay. Yeah, it is the language. When we talk about following up, in this case, it's not like maybe more the way we think about it in terms of coming back to the office for another visit. It's because the surgery hasn't been scheduled. How do we get that patient on the books? And it's always been that way, right? This isn't new for COVID. How do we get this surgery to happen? And thinking about the reasons that belong in this list, we can add and remove whatever you like, and it can go beyond the rubric of COVID. So I personally think you can either add your urgency levels into the reason, or keep the reason kind of COVID free and keep it in the notes and have kind of your own, I've forgotten the word, but very specific way of documenting it and getting everyone to follow that process.
Thank you.
Pleasure. Please make any requests via support site for quick turnaround. around the status drop down, the cancellation reason, or the follow-up reason. You'll also receive an ebook today and from our marketing department, and so we'll send out an email to the participants with the link, and if they want to, they can share it with their co-workers. We're not going to send it to everyone, right?
I think we'll just send to the attendees of this session, and they can share it as appropriate with team members.
Right. Thank you for participating, everyone, and take care of yourselves. If you have any additional questions, I'm happy to stay on the line. Take care.
We're good. Take care. Bye, girls.
Bye-bye.
Thanks. Bye. Stay safe, everyone.
You too.
Okay, thanks.